Good. Okay, so today we're going to be just talking about some of the new closed system transfer devices that the VNA is using for their CAD pump sets and for their IV pushes. So this is kind of from a nursing perspective. We're going to pretend that this extension set is actually the connection to the patient, and here's your clave. So the first thing I wanted to show you is the bag and what it's going to look like. Obviously this is the same curl and pump tubing that you've always used, so no change there. You're going to notice this little light blue thing here. This has nothing to do with nursing. I just wanted to point out that this is what the pharmacy uses to inject the 5FU into the bag, utilizing a closed system with no needles. And then here on the distal end, you've got what we call a spiros with the red cap. You'll notice that it spins freely in both directions. So what that means is that it's bonded to this set, and what you're going to be connecting to the patient is behind this red cap. So when I remove the red cap, you'll see that it's just a closed male lure. It's exactly almost the same as what you're doing if this wasn't here. This is a male lure as well. This one just allows you to be safe should there ever be an accidental disconnect. So to connect it, you just go to your clave, you're going to push that little protrusion on the spiros into the clave, and then just screw it on until it's snug. You don't have to over tighten it, just make sure that you're on there snug so it's not going to come off. And that is what will open the flow path so that the patient can receive their medication. Now, if there were ever a disconnect, right? If maybe the patient was moving around, I'm not quite sure what would cause it, but if it wasn't tight enough or whatever and it unscrewed itself and came off, the fluid path would close and there would be no chemo spill. So that's the reason for this. So in theory, if it ever disconnected, all you would need to do is swab this protrusion with alcohol, and you can just reconnect it and continue the infusion. Oops. Push, twist. There you go. So that's what happened. That's what you're going to see on the distal end. That's what's going to be the change as opposed to just the lure. So really it is the same thing, just adds a protection factor. Now for IV pushes, they're going to come out like this. You'll notice it has a spiros on it as well. Same exact thing. You're just going to remove your red cap and then connect to your patient. Now this spiros spins, so you can't grab the syringe and do it because it'll just spin. You can't get it tight. So you have to actually grab the spiros and grab the clave because the clave is removable, and then just tighten it. Now you can actually, I don't need to do this, but you can actually start, the fluid path will be open, so I can actually start pushing that drug into my patient. So just remember when you're making either this connection or the distal end of the tubing connection, because the spiros spins, you're going to want to grasp the spiros here. And then obviously a best practice would always be to grab the actual needle-free valve that you're connecting to so that you don't inadvertently disconnect it. That's it.